Mount Elizabeth Hospital Singapore Philippine office is about opening the door for new healthcare possibilities and synergistic collaboration with Philippine doctors, and to be able to utilize advanced medical technologies that are already available at Mount Elizabeth Hospital Singapore.
My name is Dory D, and we would like to welcome you and thank you all for being with us tonight. I would also like to take this opportunity to thank our dear doctors from Singapore, Dr. Lee Kuan. Thank you very much, Dr. Lee, for your willingness to travel here in the Philippines to meet and greet our Filipino doctors. And of course, Dr. Christopher Go, who is with us virtually.
Today is the Cancer Consciousness Week, and usually this is the 15th year, 2008, and then now it's 2023. So very, very significant indeed. And look forward to the 20th in 5 years' time. Okay, hopefully this will be a stronger one and more participation.
Treatment of head and neck carcinomas involved a collaborative effort among different specialties to provide a comprehensive and coordinated care to our patient. This approach recognizes that the head and neck cancer can affect multiple structures and functions of the head and neck region and requires a diverse set of expertise to effectively manage the disease and optimize patient outcome.
Today, I'd like to give you a bit of introduction to proton therapy. Proton therapy is a special kind of radiotherapy. Not so many places in the world have it because it's been rather big and expensive. But over the years, prices have been slowly coming down, and Parkway has been able to manage to install one. And we are actually just at the cusp of opening. This morning, just a few hours ago, I heard that our Ministry of Health in Singapore is happy enough to give us the license to start. So if fingers crossed, in perhaps another 2 weeks, we'll be operational.
I hope to be able to experience the innovation of this machine in the future.
Currently, we've seen how things have evolved, how things have changed, involving different modalities, different subspecialties, and here we are together in this night, given the opportunity to share with one another how to treat complex cases in head and neck. So thank you for this opportunity for this night.
Just like in medical oncology, treatment now becomes what we call the precision treatment or precision medicine, in which efficacy becomes more and more and the side effects becomes less and less. It is very important that we have this type of therapy in which the side effects is lesser but the efficacy is more.
Technology in radiotherapy has really been advancing, very rapidly in the past 20 years. And having something like a proton actually has its big advantage. I've been talking with some of the other doctors, with Dr. Pontejas earlier. What's the big advantage of proton versus the usual photon therapy, which is the linear accelerator? The biggest advantage really is sparing as much normal tissue as possible. So when you spare normal tissue, of course, the overall effect is you have less toxicity.
Help us to be instruments of your healing and a catalyst for justice in our world. Grant us wisdom as we seek out ways to improve our care and to grow in virtue. Extend your hand of blessing upon all of us who work in healthcare and upon all those who we serve, especially upon those marginalized in society. United in our common dignity, may we grow closer as a family of physicians and build a culture of life filled with reverence and love for all.